Good afternoon, I'm Mabel Jong, and thank you so much for watching the continuing coverage of the World Healthcare Congress here in Washington, D.C. And in the studio, I have with me now Judy Murphy, who is Chief Nursing Officer and Director, Global Business Services at IBM. Hi there, Judy. How are you?
Hi, Mabel.
Are you encouraged by some of the things that you're seeing in the healthcare space now?
Oh, I'm extremely excited. I mean, this is a great time to be in healthcare. Things are finally starting to change. I think a lot of the issues that we've seen in our lifetime are starting to get resolved.
And what are some of the issues you think are worth pointing out?
Mostly the way we deliver and pay for care. You know, so kind of going back, the patient was in a dependent position. Now they're in a partnership position. So I think that's changed a lot of the dynamics of what happens in healthcare, and how patients see themselves and how they engage in their own care. And then secondarily, of course, the payment, the way, you know, the escalating costs. And we're finally starting to look at, I think, some interesting ways of making sure we can curb those payments.
Well, now being a part of IBM, which is a multinational global corporation, huge with tens of thousands of employees, what is the corporate view of healthcare on the ground there?
Certainly the corporate view is the same as what I just said. It needs to change, right? So we need some innovation, we need some disruption to really create that change. One of the things that brought me to IBM, and I've really only been with IBM 6 months, is the idea that when we think about changing something like healthcare, we need the bigger companies, and we need the people that have the resources to really be part of that change. So I got really excited about some of the wraparound, I'll call it, services that IBM provides when we think about healthcare, related to things like mobility and related to things like the analytics and the infrastructure components.
Okay, what are some of the things that you've seen at IBM that could be replicated at other organizations, things that really work?
Yeah, so the two things I mentioned already would be the ones I'd refocus on, and that is, we're not going to create an electronic health record at IBM, right? There's plenty of those in the marketplace already. But what we can do is start looking at that white space in between the different systems that folks are already using. And so one of the things we see as we look at healthcare and the way it's being delivered is amalgamating or pulling together some of the disparate systems so that the practitioners, like the nurses, can actually be effective and efficient in their care delivery. So augmenting, if you will, the workflow. So a specific example would be in nursing, we deal with multiple kinds of alarms and alerts, and it could be the bed management system, the IV pump system, the call light system, as well as the electronic health record. So being able to kind of pull that together, and instead of keeping my notes about patients on a piece of paper in my pocket, the ability of having that on a mobile device that I can carry with me.
Now, was it deliberate for IBM to bring on a trained nurse to be part of their staff?
Absolutely. Very strategic. I think they have been in healthcare for a while, but doing what I would say the more traditional IBM things, right? The hardware, the infrastructure, the security systems, and even reporting and analytics. But the idea of getting back into this front end of care delivery and actually being able to take the power of analytics and the power of computing and mobility and put it in the hands of the practitioner. And so, yeah, I'm one of the experienced people that they brought on to do that.
Is there a physician on board too?
Oh, they have quite a number of physicians as well. In all different aspects throughout IBM, but certainly helping with this front-end care delivery redesign.
Yes. What is the panel that you hosted today?
Yeah, the panel was about accountable care, which is extremely exciting when we talk about disruptive innovation. And we start to think about that changing dynamic again, about how we deliver care and how we pay for care.
And what was the overriding message that you left with attendees, and what did you hear that was worth keeping with you?
So we had 3 CEOs engaged in the panel, all in different aspects and in different mechanisms for doing accountable care organizations. But some of the consistent themes were, you got to jump in. The analogy that was used was a boat tied up to a dock. You know, the dock is traditional and the boat is the new stuff. Well, you know, the boat starts leaving and you just got to jump in the boat. Meaning you got to go all in, you really got to try to figure this out. And it is, again, disruptive. And yet it is very innovative. And you can use the what you know about the way healthcare is delivered to change it enough that your incentives change for the providers as well.
And what is the message you want to leave with folks?
I think the biggest message that I have is we have to change.
Yeah.
And there's going to be some pain in that, but there's going to be a lot of excitement in that as well. And so let's go all in. Let's do it.
All right, go for it. All right, Judy, thank you so much for your time today. I really
thank you.
appreciate the time.
Thank you.
And I'm Mabel Jong. Thanks for watching.